got to be honest, I don't know whether I should disclose this or not, because my 16-year-old daughter knew what this was, and I didn't know what this was. So what does that say? Plastic surgeon, been in the game God knows how many years. Do we offer top surgery? I've got to be honest, I had an inkling it has something to do with transgender, but I wasn't entirely sure. So I have Googled it, full disclosure. And basically, yeah, it's transgender surgery involving, I think it was female to male sex change patients. And no, I don't do transgender surgery for two reasons. First reason is technically surgically. I mean, I probably could do it, but I think it's one of those things that, although you could say, look, basically it's a mastectomy, and similar, male to female is basically putting implants in. There are nuances to it, and it's not quite as straightforward as that. But I think if push came to shove, I think any sort of breast plastic surgeon could do it. But it is a specialty in its own right. But secondly, and perhaps most importantly, transgender surgery needs to be done within a multidisciplinary team. So it requires a psychologist and often a medical doctor who will look after the hormonal side of things, often gynecology, maybe urology. There'll be all sorts of doctors, breast surgeon perhaps, who will be involved in this multidisciplinary team. And I just am not in that setting. There's a colleague of mine, I don't know if he still does it, but Guy Stern used to do this sort of work in this region. But there's usually people in the region who will specialize in that sort of thing. And so I would leave it to those people who have got that network of other colleagues who will be able to help in the whole management of the patient. So although I do breast surgery, I don't do transgender because it is a specialty fulfilled by one of my colleagues. So no, I don't offer that.